Hello, my name is Lauren, and I will be sharing the pathophysiology and disease process of multiple sclerosis. It is a progressive autoimmune disease that leads to myelin loss and damage not only to the central nervous system, but also damage to the autonomic nervous system. This disease causes inflammation and scarring to the nerve, which also the scarring causes a decrease in nerve transmission. Sensory and motor problems for individuals occur secondary to the disease, affecting the nerve cells in the brain and spinal cord. MS is characterized by exacerbations and remissions, which I'll discuss further. Multiple sclerosis is the most common immune-mediated inflammatory demyelinating disease of the central nervous system. The prognosis varies. 70% of individuals can lead active lives with sustained remission. The pathophysiology of MS is a heterogeneous disorder with major pathological mechanisms that cause many different clinical manifestations. Not every individual experiences the same clinical manifestations. MS is an exacerbating and remitting disease that is characterized by demyelinization of brain matter, damage to axons, and decreasing number of oligodendrocytes in the central nervous system. MS begins as an inflammatory immune-mediated disease. Characterized by autoreacted lymphocytes. I do want to discuss really quick the anatomy and physiology of the nerve cell, the neuron, which may help understand the pathophysiology of MS. You have the dendrites that receive the signal to create some sort of action in the nerve. The signal goes down to the soma, which means the body or the structure. This helps pass the signal received from the dendrites to the rest of the neuron. The signal then passes down where the soma and the neuron and axon connect. Then from there, it goes down the long area known as the axon. For the axon to be able to deliver the signal properly to either another neuron, muscle, or gland, it must be nicely insulated and protected by this myelin sheath, which is made of fats and proteins. And this is where the problem with MS occurs. The myelin sheath has experienced demyelinization, so the signal isn't being transmitted properly to the area that the nerve supplies. So in MS, we're talking about the nerve cells in the central nervous system, which is our brain and spinal cord. And because of this, we can expect some of those sensory type symptoms that I'll discuss later, such as coordination, emotional, cognitive, or some of your bladder issues. I do want to discuss also neurological dysfunction is based on location of the plaques. The lesions tend to be on the optic nerves, spinal cord, cerebellum, brainstem, and white matter. This is interesting. The immunopathology of MS, it has a defining role in the immune system and the development of MS. It is autoimmune inflammatory disease, which has altered interactions between the cell-mediated T cells and antibody B cell activity in myeloid cells. In early development of MS, there are some studies that have shown disruption of the blood-brain barrier, and research has shown suspicion to the exposure of foreign antigens such as virus, bacteria that can provide an antigenic trigger for MS. There is also, this is the interesting, also attention centered around Epstein-Barr virus. The disease affects young adults between the ages of 15 and 45 and affects women more than men. Exacerbation and symptoms can be caused by an individual experiencing extreme cold, heat, fatigue, infection, stress, or pregnancy, and the exact cause is unknown. Some family, some risk factors include family history, Northern European ancestry, environmental factors, which were discussed before, living in different temperature zones, viral infections. Some major signs and symptoms. Symptoms will vary among patients due to different areas of the central nervous system that are affected. There is emotional cognitive, as you can see. I won't read through all of these, but feeling drained, weak, depressed, having difficulty articulating words and speech, mood swings. Some sensation issues are numbness and tingling in the face or extremities. You'll also see dizziness, vertigo, ataxia, difficulty moving muscles and coordination, some slurred speech. Also, the Romberg sign, which is there, is where an individual is unable to be aware of their body position when their eyes are closed. So vision problems, you'll see there, blindness in one eye, seeing dark spots in vision, elimination, spastic bladder, urinary incontinence, problems urinating, some complications. Also, symptoms can come and go. This is called relapsing remitting multiple sclerosis, which I'll discuss down below. So cognitive impairment is a common symptom. It's prevalent in about 50 to 60% of the cases. Also optic nerve atrophy, UTI, respiratory infections. And then, as I mentioned before, symptoms exacerbate during heat exposure. Stages of MS, you have your relapsing remitting. This is clear relapses or acute attacks. Typically, this has full recovery, no lasting disabilities, and approximately 85% of cases. It can involve a single case, a single episode, or benign MS. Then you have your primary progressive, which is steadily progressing, worsening with minor recovery or plateaus. This could possibly involve different parts of the brain or the spinal cord, and it's approximately 10% of cases. Then you have your secondary progressive, which the relapses, this is kind of the beginning of a pattern or clear-cut relapses in recovery, but becoming more steadily progressive and worsening between acute attacks. And this is approximately 50% of cases. This is the relapsing remitting type change to secondary progressive within 10 years of onset. And then lastly, you have your progressive relapsing, and that is steadily progressing, but at the same time, you're having these clear acute attacks, and this is less than 5%. You have your diagnostics of, you want to assess the CSF for IgG, MRI to reveal the plaques, and you have the optical coherence tomography as well. The references are listed down below, and I am going to share a story. I won't share it on here because I feel like this has been long enough, about how I had an exposure to black mold, and it affected inflammation in my brain, and I was getting misdiagnosed with MS. My symptoms were identical to MS, and I put the immunopathology of MS in here because it was very similar to what I was going through. And just the connections are very interesting for me. And I think as upcoming clinicians, it is very important that we are thinking outside the box and looking at environmental factors that may be contributing to illness, because I was dismissed for probably about 6 months. And my body was very sick and experiencing reaction to some very toxic black molds from a water leak. So I will share this story in a post to somebody else. And thank you for listening. Thank you.